I'd just like to take a minute to talk a little bit about IAPB for those who may not be familiar with it. It's the International Agency for the Prevention of Blindness. It was established in 1970 to bring together non-governmental organizations, governments, and the World Health Organization, as well as the professional organizations of ophthalmology and optometry, in order to deal with the issues around blindness prevention. In the IAPB world, there are 7 regions, and this is you lie in what we call the North America region, along with Canada and the US. And each of the regions has a regional chair, and I'm very pleased to serve the function here in North America. As part of our ongoing efforts, we sponsor World Sight Day activities around the world. And leading up to this year's World Sight Day, a report was published, which appears on page 11 of your agenda. And what this report was about, in particular this year, focused on the transition into what Dr. Juan Carlos Silva will be speaking about for quite a period of time, and that is the new World Health Assembly resolutions toward universal eye health. Next slide, please. And so the report really dealt with a number of the issues that involve the movement of incorporating universal eye care into universal health care. This is just some pages from the report to highlight it. Just to keep in mind, there are about 285 million people with visual impairment around the world, and 4 out of the 5 cases are avoidable. And this is something that we keep reminding people of, the impact and importance of blindness as a disability on the world stage, and also the fact that it is a preventable condition by and large. During the past 10 years, there have been a number of World Health Assembly resolutions that have been passed supporting activities in the area of blindness prevention. And then in May of 2013, that's highlighted here, the Global Action Plan of 2014 to 2019 was adopted by the member states of the World Health Assembly. And so now, for the first time, you have 194 countries acknowledging the importance of universal eye health and have committed to reducing the prevalence of avoidable visual impairment. And this, for us, is a great milestone, because one of the problems I think you all realize is that, unfortunately, eye care tends to be somewhat marginalized in the larger picture of healthcare. And what this is saying is that we want to be in the big tent of healthcare, and particularly in those areas we want to be at the table when resources are being divvied up to make sure that blindness prevention activities get their fair share of resources. The main elements of that governments need to do to take part in this is comprehensive eye care services need to offer a breadth of services covering the range of causes of vision impairment, from promotion, prevention, to rehabilitation and care. Secondly, eye health integrated in health systems, attending to the 6 building blocks of a health system according to WHO: governance, health financing, service delivery, human resources, medicines and technologies, and information. The third step is access for everyone, including the poor, minorities, the disabled, including vision impaired, people in rural areas. This requires adequate health outreach and promotion, including inappropriate technologies and formats, and ensuring mainstream and targeted programs to address barriers. And finally, the fourth point, the point of care payment should not prevent access. It should be free for the poorest. And so these were the 4 main elements that we've asked governments to undertake as this program unfolds. Now, in the report on World Sight Day, there is a section on North America. And I thought I'd just take a few minutes to tell you about what else is going on in our region. In the United States, kind of following on your lead, we've been able to institute an annual eye health day in Washington, where about 200 people gather representing all the major organizations around the country, including our U.S. government, which for us is a very revolutionary thing. Talking to our government is not the easiest thing to do. They listen to us all the time, as we're finding out, but they're not talking a lot. And so what we've been able to do at this meeting is begin to kind of form a consensus, as you've done, around the major issues dealing with vision disabilities and the importance of blindness prevention activities. As part of this report this past year, a study was done looking at the cost of blindness, the economic burden in the United States. And on an annual basis, it's about $139 billion that's been estimated. Now you say, well, that's an interesting number. Why do you bother doing that? Well, one of the discussion points you have to have when you're talking to health planners, I think as you all know, is your problem significant? Is this really impacting the health of the country? And by generating this kind of number, we can say to them, absolutely, we are significant. We're probably the 5th or 6th most common and expensive form of disability. And we have proven abilities to reduce this, to eliminate avoidable blindness, to actually show an economic advantage of a 2-to-1 to 4-to-1 ratio, so that for every dollar you spend in this area, you in fact are going to get between $2 and $4 back of benefit. So this number was a very, very important advocacy tool for us in the United States, and I think you can extrapolate this to many other countries in the region. In Canada, they formed a Vision 2020 National Committee, and again, they've used the idea of shared partnerships in order to move the agenda forward there in blindness prevention. I was also pleased that as part of this report, we could highlight in Barbados the glaucoma screening day that Dr. Grosvenor has put together there about it. But this has been a particularly successful endeavor. I'm sure you know as much about it as I do, but it's really amazing to visit Barbados and see what can be mobilized. And I was very pleased that this could be included in the report from your sub-region so that others in the world can hear about what you're able to achieve here. So I'm going to end my presentation now. I'm happy to take any questions that people have about IAPD and what's happening